Hi, good afternoon, everyone. This is Natalie Ellis at Esteem Counseling and Consulting Services, and this is Ask the Therapist with Natalie. And today I wanted to talk a little bit about overcoming traumatic experiences, and obviously there's lots of different types of traumatic experiences out there. I don't know if you all heard about the young man who plays Empire, Jussie Smollett, and he was a victim of a hate crime where some people assaulted him and threw bleach on him and put a noose. I'm not sure if it's around his neck or just put a noose near him. But again, that is considered a very traumatic experience. And believe it or not, there's studies out there that show that a lot of people have had a lot of adverse experiences in their childhood and in their lives. And part I wanted to just briefly talk about is just ways to overcoming it, okay? And part of my role as a therapist is definitely to continue to spread the word about the importance of mental health and getting therapy and doing the work and whatever that work is. And for me, it is therapy. I talk to people about coming into therapy and doing the work that they need to get well, to heal, okay? And so first, let's talk a little bit about trauma. So as a therapist, one of the ways that we diagnose is we look at symptoms, okay? And diagnosing is just is just used as a common language, okay? So a diagnosis is for multiple purposes, and some is for insurance purposes, some is to get money. There's different reasons why people diagnose. I don't do a lot of diagnosis in my office. However, when I first meet with clients, I do an assessment and I gather all the information that they've said. And based on all that information, we look at what's going on. And then I would say, well, it sounds like based on all these symptoms that there may be some of this going on or some of this going on. Okay. And then the goal is, well, how do we work through those different things we have going on? And in that, we come up with diagnosis if we need to. Some people, it helps them to know that there is some form of diagnosis, there's some form of terminology to describe the things that's going on with them. And so when people have experienced a traumatic, something traumatic, more likely they may fit different symptoms, and here they are diagnosed with PTSD. So this is the book that we look at to do diagnosing. This is the Diagnostic and Statistical Manual of Mental Disorders, the DSM. Okay? And so, and after a while you get to know a lot of the symptoms and things of that sort, so I don't refer to the book so much anymore when I work with clients. But again, for the purpose of what we're doing, I wanted to talk a little bit about trauma and overcoming trauma. And to do that, I wanted to talk a little bit about what that is, okay? And so trauma and stress-related disorders, okay? And so I'm going to read a little bit of what it says in the DSM. Disorders include trauma and stressor-related disorders include disorders in which exposure to a traumatic stress or stressful event is listed explicitly as a diagnostic criteria, okay? And so there's different kinds of disorders that could be used. We have reactive attachment disorder, disinhibited social engagement disorder, PTSD, post-traumatic stress disorder, acute stress disorder, and adjustment disorder. So there's various types, okay? Psychological distress following exposure to a traumatic or stressful event is quite variable, okay? So it could be in so many cases. In some cases, symptoms can be well understood within an anxiety or fear-based context. It is clear, however, that many individuals who have been exposed to a traumatic or stressful event exhibit a phenotype in which, rather than anxiety or fear, the most prominent clinical characteristics are dysphoric symptoms, meaning externalizing anger, aggressive symptoms, or dissociative symptoms, okay? Because of these variable expressions of clinical distress following exposure to a catastrophic or aversive disorder, that's mentioned, there could be various symptoms. All right. So, because this gets really complicated, so which is why I don't go through some of this with clients, because going through the DSM gets pretty complex. But some of the things that I wanted to make sure we address in terms of the PTSD. All right, so I'm going to go to the PTSD, post-traumatic stress disorder, okay, and some symptoms to some of the criteria that we look at. All right. The following criteria apply to adults, adolescents, and children older than 6, although children younger than 6 can also experience PTSD. Okay. We may label it something else in terms of adjustment disorder, and then it may get to become PTSD. But obviously, we do know that children under the age of 6 also experience PTSD and trauma. Okay. So these are some of the criteria that we have to look at. Exposure to an actual or threatened event, okay, whether it's a death, a serious injury, or sexual violence, directly experiencing that trauma, witnessing a person that's going through that trauma, learning that traumatic events occurred to a close family member or a close friend. So just hearing that someone experienced a traumatic event sometimes may create a trauma for us as well. Experiencing repeated or extreme exposure to an aversive details of a traumatic event. Okay, for example, like first responders, police officers, they may experience that. Okay, so an exposure to an actual or threatened death, serious injury, or sexual violence in one of the following ways. Okay, presence of one or more of the following intrusion symptoms. Okay, after experiencing a trauma, whether or not you have a recurrent, involuntary, and intrusive distressing memory of the trauma, that's a symptom to look at. Recurrent distressing dreams in which the content and or affect of the dream are related to the traumatic event, that's something else to pay attention to in regards to the trauma. Or dissociative reactions, like flashbacks, in which the individual feels or acts as if the traumatic events were occurring. Okay, so those things to pay attention to in regards to the trauma. Intense or prolonged psychological distress at exposure to internal or external cues. Okay, so sometimes we experience a trauma, and then there's we have reminders or triggers, and every time we're reminded of that, for example, certain smells. The thing about trauma impacts us in all of our senses, and so there may be situations where we experience a trauma and we don't always remember it in our head. However, our body remembers it somehow. And so we could smell something and it reminds us of an incident, or our body starts to shiver, or our body starts to feel different because of that smell, because of something we hear, something we taste, something we see. And so trauma is impacted by all of our senses, and all that can be triggered. Okay? And the fact that you're trying to avoid things that's related to the trauma also could be a symptom or a criteria for PTSD. Okay, and so there's lots of criteria that falls under PTSD, and so let's talk a little bit about some things that could be considered traumatic, and that could be again different for so many different people. We have again assault, sexual assault, physical assault. People exposure to domestic violence, and at different levels of that domestic violence, that could be traumatic. School shootings. There's natural disasters could be considered traumatic as well. Let's see. So there's different things that could be considered traumatic that we have to be aware of. And the thing about the trauma, the other big piece to that too is people respond to trauma differently depending on their own experiences and their definition of what that traumatic thing may be for them. And so there could be someone who may never have, how can I explain this? Someone who's never heard gunshots before, right? And so the first time hearing the gunshot, that situation may become very traumatic for them. Okay, versus somebody who may be in situations where part of their upbringing is to hear the gunshot. So their response and reaction to hearing that gunshot may be totally different, okay, based on their meaning and based on their experiences. And so those are the things to also be aware of in regards to trauma. And so when we've experienced some type of traumatic experience, right, it's important to start paying attention to what's going on with us. Oftentimes, obviously, when we experience something, we just want to get back to business as usual. We just want to get back to ourselves. We just want to get back to living normally. We just want everything to just get back to normal, right? And there's times we can do that. And there's times it's really, really difficult to do that. And so even whether it's difficult or whether we're able to do that, it's important to allow ourselves to acknowledge the feelings, the emotions, the experience that we went through. Because the trauma oftentimes is really intense and scary and full of distress, we just want to put it in a box, right? We just want to stuff it all in a box and just kind of leave it in there. And what that does when we do that, obviously it's in the box and it's heavy, but it's inside of us still. And as we continue on, we just continue to put more things inside of that box. And obviously that box becomes very, very full, right? Which is why, again, I say it's really important to kind of really notice what's going on with us. And so in the moving on process, it's important to also take the step back to allow ourselves to feel whatever it is that we're feeling in regards to that particular traumatic experience. And at times we may have to seek professional help. And so there's things we can do within ourselves to kind of work through some of that experience and work through some of the hurt and pain that we're going through in regards to that experience. But again, whether it's spiritual assistance and spiritual guidance, whether it's professional mental health assistance and guidance, whether it's physically going to the doctor, because again, trauma also impacts the body physically, where we start to have physical symptoms, whether it's stomach issues, gastro issues, heart issues, high blood pressure. All those things starts to impact because, again, the trauma creates anxiety, creates depression. And so it could impact the body as well. Okay? And so really noticing all parts of us, what's going on in terms of our thinking patterns, because, again, also when we experience a trauma, our feeling of safety is now jeopardized. Our sense of the world, our definition and understanding of the world is also jeopardized depending on whatever that traumatic experience that may be. And so it's really important to pay attention to what are the thoughts, what are the thinking patterns what are the things we're telling ourselves, what are the things we're saying, okay? So noticing what's going on in terms of our emotions. Are we sad? Are we mad? Are we depressed? Are we isolated? Do we not want to be bothered? Are we crying a lot? Are we not doing the things we used to do anymore? So noticing what's going on in terms of our emotions. And then also noticing our actions too, in terms of isolation. Do we not want to be around other people? Do we find ourselves sleeping a lot? Are we irritable? So irritability, are we lashing out? And so noticing all these things, in terms of our thoughts, in terms of our feelings, our actions, and then our body, noticing what's going on in our body. All these things we need to not dismiss. As we're moving forward, we also need to know what's going on with that and not stuff it all in that box. Because stuffing it in the box, guess what? The box will become full and it will explode. It will, right? And so that will happen. And the key is we want to kind of make sure it doesn't just happen. That we're trying to, the best way we know how to manage all of that stuff. And so to do that is to acknowledge those things. Facing something head on, I guess, that's the expression. And so facing our mental health, facing our experiences, facing our traumas, facing our emotions, facing the things that we have, kind of working through it head on, dealing with it head on, increases our chances of managing it better versus just kind of pushing it all out. And so the pushing things away is a temporary solution. Yes, in the moment it will work. In the moment, if I'm going to work, I can't think about all this stuff right now, so I need to put it in this box, right? Yes. So in the moment, dismissing, avoiding, not addressing certain things, pretending, and all those things, denial, all those things work, but for the moment, right? But if we're continuously putting things away and not addressing things, every moment that we're experiencing things, we're not addressing it, we're putting it away, that will catch up to us very quickly. And so, again, in these moments, we could put things away, but then at some point during the day, in the evening, before we go to bed, and during that week, you know what? I had this happen. How do I go through the box and address this? Okay, how do I address this? What do I need to do? Okay, and again, some of us may need professional help to do that, which is what therapy is really, really good for. So when clients come to see me, we go through an assessment to kind of see what's going on, and then we identify the goals. What are the things we want to work on? And they're telling me what are the things, and ultimately not what I want to work on. The sessions are for clients. These sessions are for you, okay? And what is it that you want to work on? What is it that you'd like to see in your life, or whatever that is? And so then my goal is to help you get to that point, to help facilitate clients in getting to that point. And ultimately to get to the point of healing, to get to the point of being well, okay? And therapy is just a process in that. It's just a way of doing that. There's a lot of things we can do in therapy when we talk about trauma. I utilize a lot of different treatment modalities. So I do trauma-focused cognitive behavior therapy with let's say my kid clients when I have kids. So we do a lot of trauma-focused cognitive behavior therapy. Whereas we're focusing on the trauma, however, we're also focusing on their thinking patterns. We're developing skills. We're coping skills, relaxation skills, ways to manage the emotions. Okay, because again, when we've experienced the trauma, we're constantly in our emotions with this experience, and so learning how to manage that, not dismiss it, not pretend it's not there, but I am feeling this. Okay, what is this feeling that I'm feeling? Okay. What is it about? Okay. Anger. Okay. What am I angry about? Okay, kind of acknowledging some of that. Okay. I know I'm angry. Okay, I know I can't kick or hit because I'm angry. So managing in terms of, okay, what are some other things I could do when I'm angry? All right, squeeze a ball, go color, So developing tools to manage that anger and to express that anger, because again, our emotions and feelings, it is what it is, that, and it's valid. Okay, it's perfectly valid to feel whatever it is you're going to feel. It's perfectly valid. It's perfectly okay. All right. It's not okay for me to say, oh, you shouldn't be angry about that. No, it's your right to feel what you feel about whatever the circumstances are. The key is, what do we do with all of that? Okay? And so developing tools, developing strategies to manage whatever the emotion is that we need to manage. Okay, so TFCBT helps with that. It helps, again, develop tools, develop skills. We do psychoeducation about whatever that trauma is. And then we talk about the specific trauma and address all the things in regards to that trauma and process those things in regards to that trauma. And that becomes really, really important when we do trauma work. Okay, to really, all the things you're trying to put in the back of your head about that particular trauma, about that event, we want to kind of put it in the forefront in therapy. Okay, because as long as it's in the back of your head, as long as it's inside that box, it's still doing things to us. Whether we acknowledge it or not, it's still doing things to us. It's still impacting our emotions. It's still impacting our reactions, our actions, our thoughts, our feelings, right? And so part of that healing and part of that overcoming is to, let's actually look at this. Let's look at it. Let's address it. And let's figure out what we need to do. And that's not easy. And that's not easy work. And I know, and that's something I tell my clients all the time. It takes a lot of strength, a lot of vulnerability to come sit right here in front of me on that chair to kind of address all those things. But in my 20 years of doing this, when it's done, it just feels so much better. It does. It feels so much better because there is a difference when we're carrying a whole lot of weight versus when we're not. When we're carrying a lot of things. And again, we don't want to carry a lot of weight. We don't want that because life continues to happen. We continue to experience things, and when we already have too much in there that we're dealing with, then it just becomes too much. And so somebody says it's scary but worth it. Definitely scary but worth it to bring all that out and to address all those things. So it's important that we do that to take that load off. So those are some things that I would say in terms of overcoming is to really acknowledge what's going on, seek the help, and in regards to therapy, because again, not every therapist work with trauma, not every therapist have the tools and skills to help every individual. And so when people are looking for therapists, it's important to it's like a job, it's like everything else. You want to make sure that you too are interviewing the person, you too are asking the person the question. There has to be a sense of I don't want to say comfortability, but feeling as if you can feel safe to address these things, because you do need a safe place. Okay, so to deal with these trauma, you have to be in a place where you can be safe to talk about these things, to address these things, to process these things. So you need to be in a safe place to do that, which is what I think therapy really helps people with, to be in that space to do that and to address it. And so, let me make sure I talked about what I want to talk about. So I talked about a form of therapy, which is TFCBT, which I do a lot with my kid clients. There's another treatment called EMDR, eye movement desensitization reprocessing, which has worked a lot with veterans. It's a form of treatment to work with trauma. And then the other stuff is CBT, cognitive behavior therapy. That's a lot of the things that I do with a lot of my clients, where we talk about the stuff that's going on, we process it. I'm a very visual person, so I do diagrams, I give examples, do homework assignments, really allowing people to process whatever's going on, to really get in depth and talking about the things that's going on with them. And with my work too, I do go back a lot. So a lot of who we are in the present and how we deal with things in the present is based on a lot of our past. And so in dealing with the present with a lot of my clients, we got to talk about a lot of stuff from our past as well, from our upbringing, our values, our beliefs, our relationships from our past, and then how does that also impact what's going on in the present. And so those are the things that I do in helping clients work on their trauma and ways to overcome. And so overcoming the trauma, I would say definitely acknowledging. Again, the first inclination when we experience something that's scary, something that's shameful and scary and embarrassing, whatever, the worst, when we've experienced these things, the first thing is just get over it, is move forward and just try to put it behind us. And so that's the first inclination. And again, that could work for just the moment, but again, the way to heal long term is to really bring it to the table and to address it. And so it's like you're bringing it, addressing all the things that's in there in regards to that trauma, talking about it, allowing yourself to feel whatever's you're feeling, and addressing it. So that would be a step in terms of overcoming. And so to do that, if you need to seek a therapist. In that, so therapists themselves don't prescribe medication. Sometimes in that process, there's individuals who are in need of medication, and so they may be referred to a psychiatrist. But again, that's up to the client and where they are in their work, in how their behavior, how it's manifesting in their behavior and their symptoms as well. So that's something else people can look at also. So just want to talk a little bit about that trauma. Hopefully it was worth it. Like somebody said, scary but worth it. Okay, coming to therapy. Had one client, the last client that I had, she finished up her 8 sessions. I take EAP, and she finished up one of her 8 sessions and we'll take a little break for a little bit and then moving on, is that it cleared the fog for her. Oftentimes when we have something, again, heavy, so even though it's back here, it does create a fog. And so for her, what we did a lot of is clearing up that fog. And so sometimes that's the first step, is how to clear up the fog so we could know what to do next. But when we got so much stuff that's kind of blinding us, it's just kind of, it's hard to move. It's hard to know what to do. It's hard to function in the best way we know how to function. And so in order to get to live our best life and be our best selves, we have to clear that fog. And part of clearing that fog is we got to empty the load that's going on. So hopefully this was helpful for you guys. Again, my name is Natalie Ellis. I have a private practice in the Decatur area. I take most insurance, but I do EAP as well, which is employee assistance. I do some of that, and I do sliding scale as well. And so I truly, truly, truly encourage people to get help and seek help in whatever that capacity is. And for me, my part is the mental health piece. And so if in acknowledging the things that you have going on, you're thinking, you know what, I really need to seek help, go for it. Seek the help and take that step to heal and get well. Okay? Thank you so much for listening in, and I appreciate you guys, and thank you for joining me today on Ask the Therapist. Okay? I'm going to say, does anybody have any questions before I close out? And if not, I will. Hearts to you too. Okay. All right. My information is also on my profile, I guess. So if anybody has any questions to just ask me personally, you could always do that through my profile. And then we could talk about those things. Okay. But thank you so much, and I'll see you next time.